means either you're getting ready to leave or you're getting ready to jump up and down. Yes. All right, everybody up. Come on now. Let's get some energy going. Make believe you have energy. Make believe you're healthy. Turn to your neighbor, say, I'm ready. Arms up. And morning champion. Morning champion. Woohoo! All right, good job, good job. We are awake. We are ready. Say, I'm ready. Okay, I'm ready too. So, who's ready to fix their broken brain? Say aye. Aye. Okay, who's ready to prevent their brain breaking? Say aye. That's me. Yes, we're all in the same boat pretty much. We want to see what's good and what we can do better, right or right?
Right.
All right, so thank you for being here tonight. We've got a great workshop, and we're just going to jump right in. So we see the scales there, which obviously need to be balanced. When the scales go unbalanced, then we have problems that start to develop. Can everybody hear me okay with the mic? Can you hear me in the speakers in the ceiling? Just want to double check there. Yep. Yes? Is it coming through? Coming through from above? Over? From overhead? Yeah? Can you hear it? I can't hear it. I can't. Can you hear it? Yes? Okay. I just want to make sure our Facebook friends can hear it. That's the only way that they can hear it. So, we're talking about health being not a balanced approach, but an unbalanced approach. What? What do you mean an unbalanced approach? Well, we know what most people do, conventionally speaking, when it comes to treating the disease. But very few people ever ask the question, what is the cause? Everybody say cause. Cause. So, the standard of care with our medical system is just to treat effects, treat disease. What we always want to do is, from a preventative standpoint, ask what is the cause, the source, and the root of why I have a health problem, and how can I address that? And then more importantly, once we get that addressed, make sure that we don't ever wind up there again in the first place. So when we're talking about brain disease, we're going to address things like Alzheimer's, Parkinson's, dementia, cognitive decline, and memory loss. And, you know, we have to make sure that the scales are unbalanced as far as doing more good things than bad. The more healthy things that we do than unhealthy things, lifestyle-wise, we're going to have an unbalanced equation in favor of us building health instead of building disease. Does that make sense? Yes. Okay, so the things that we're going to cover tonight, which undoubtedly are lifestyle approaches, which can turn off the dementia and Alzheimer's genetic predispositions that some of us have, lower your risk of that, and also many other degenerative diseases, which encompasses a healthy nervous system, nutrition, oxygenation, stress management, and can I? Can I? Can you? What is can I? Anybody know what can I is? It's an acronym. Constant and never-ending improvement. That means that we're always striving to see what we can do to learn and grow, because when we stop learning and stop growing, we start what? Dying. Yeah. So you're going to see how this all works together tonight. Dementia and Alzheimer's, we know today is the fastest growing disease. It's all around us. How many of you have had conversations with me saying, oh, 20, 30, 40 years ago, who had dementia? Like, you can't think of how far and few between that conversation was that a family member, loved one, a friend had dementia. Today, it's what? It happens a lot. It's very, very common. 1 out of seniors over the age of 65 has Alzheimer's dementia. Typical life expectancy once you're diagnosed is 4 to 8 years. 2 out of 3 people with Alzheimer's are women, and 1.5 million people diagnosed with Parkinson's, which is, it's not dementia, but there's dementia, which is part of that equation, which is a neurodegenerative disorder. One of the things that you'll see with the brain pictures there, we see with a Alzheimer's brain compared to a healthy brain is that it's not bigger, it's what? Smaller. So we know that we lose brain volume for a number of reasons as time goes on, and one of the things that's characteristic of the Alzheimer brain is the neurofibrils get entangled in the beta amyloid plaques. Raise your hand if you've heard of that. So we're going to talk a little bit about that tonight and what causes things to get tangled up there, stops your brain from firing properly, and causes memory loss and cognitive issues, but just wanted to give you a little picture of that. And I want to share this also, the power of lifestyle choices, just to show you how powerful some of these lifestyle improvements actually can be. Dr. Dale Bredesen, who's a neurologist specializing in the treatment of Alzheimer's, published a paper on this in terms of what he did for his patients. Power of lifestyle choices for prevention and treatment of dementia. So he did this in 2014. He was taking care of patients with Alzheimer's, and all he did was implement healthy lifestyle choices. He was able to reverse Alzheimer's in, what does that say? 9 out of 10 of his patients. So then we contrast that with an FDA-approved drug from last year called lecanemab, and which they showed doesn't actually stop Alzheimer's disease. It'll slow it down, definitely doesn't reverse it, slows the decline by 27%. That's pretty much it. You cannot stop the progression of it once it's on its way. In a study that was similar to this, in the same period of time, they showed extra virgin olive oil alone worked in a trial better than this drug. Extra virgin olive oil. Now we're going to circle back, but I just wanted each and every one of you to see that this is a real thing. This lifestyle thing is actually a real thing. Now it's not a substitute for a drug. It's not a treatment for a condition. It's really more or less just getting your body what it needs, the basic building blocks, so that you can build health and healthy cells instead of disease. And it's really as simple as that, having the right recipe. So just understand with Alzheimer's, with Parkinson's, with diabetes, heart disease, it doesn't matter what the disease is. We all have predisposition to that runs in your family and my family. We know what that is. Some of it is cancer. But you have to understand it's not the genes that determine your destiny. It's the expression of those genes. And you're either going to make decisions every day and lifestyle choices that are going to turn those genes on to express themselves, whatever you have a predisposition for, or you're going to do things to turn them off and reduce your risk of that disease. Is that making sense? Yeah. So that's what I want to get into with you. First thing also we know is that certain drugs will actually increase your risk of dementia. And a lot of them are over-the-counter drugs, and some of them are prescription drugs. Anticholinergic drugs. Choline, acetylcholine particularly in your brain, plays a key role in attention, concentration, memory formation. And that's why the anticholinergic drugs, which actually stop that, cause symptoms identical to dementia. So I want to show you what these drugs are in just a second, but there's lots of research that statistically shows the association between dementia and the anticholinergic drugs, the antidepressants, anti-Parkinson's drugs, antipsychotics, a lot of these anti-bladder drugs, anti-epileptic drugs. So what happens is, not just the prescription drugs, but the over-the-counter drugs, all these things that block acetylcholine start to provoke the symptoms of dementia. So what can that be? Benadryl, the allergy medications, chlorotrimidine, again, an allergy medication, Unisom, Tylenol PM, Aleve PM, these sleeping medications that help you sleep, what are they doing? They're turning your brain off, basically, to allow you to stop thinking and relax and go to sleep. Dramamine, what is that? For motion sickness. Yeah. And finally, the daytime, nighttime, coughing, sneezing, aching medication. So we have a NyQuil AM, we have a NyQuil PM. Pretty soon we'll have an afternoon NyQuil also, right? So how many of us have these medications lurking in our medicine chest? How many of us really grew up taking these, just thinking that there was no consequence at all? Now we know, a study published in the Journal of the American Medical Association found that overall high use of anticholinergic medications for 3 years or more was associated with a 54% increase risk for dementia compared to non-use. So my purpose is to bring this to light so you start thinking about these things. And again, it's always going to be what not to do and what to do instead. Now, don't get me wrong. I'm not saying that there's not a time and place for a prescription drug, over-the-counter drug, or a medication. But clearly, we live in the United States, the capital of the world for pill popping, right? There's a pill for every ill in this country, and we have a pill popping mindset that we should be living on medications as we get older. It's normal because it's so common. It's what everybody does. Everybody's on diabetes medications. Everybody's on cholesterol medications. Everybody's on high blood pressure medications. So it must be normal if I'm on it. Don't confuse common with normal. Doesn't have to be that way. Other drugs that cause memory loss: incontinence drugs, muscle relaxers, narcotics, painkillers, anti-seizure meds, Parkinson's medications, antidepressants, and antipsychotics. I'm not going to get into each one of those, but I want you to put that on your radar. If you're trying to prevent it, again, this should be on your radar, things to look out for that you can address. Cholesterol drugs. Again, put this on your radar. Very important. Cholesterol drugs, I want everybody to say that. What does that say in underline right there? Do not protect against cardiovascular disease and more than double your risk of dementia. You need to get this right now, that if you're taking a cholesterol medication and you haven't had a stroke, you're not a stroke patient, you have a false expectation of preventing a heart attack or heart disease. And I'm sorry, you've been lied to. Now you can reference this on your own. It's not my fault or your fault if you're going to see a doctor who's still prescribing you cholesterol medications because your LDL is too high or your total cholesterol is too high. That's bunk science. Bunk science. If you deprive the brain of cholesterol, you directly affect the function of the brain neurons. The neurons in your brain, which need to fire to enable you to form concepts, memory, recall. How many of you guys want neurons firing in your brain? Say aye. Aye. Okay, you need cholesterol to do that. And if you strip the cholesterol out of your brain and your body, you're doing a disservice. You're doing harm. LDL cholesterol, is that the good or the bad cholesterol? Bad, that's what we've been taught. So there is no such thing as good cholesterol or bad cholesterol, by the way. It's just cholesterol. They're different density particles. And both of those transport life-giving cholesterol to the neurons in your brain. So they're actually both necessary. But it plays a crucial protective role in brain function and your immune system. And what do they tell you to do always with your LDL? You don't want it high, you want it what? Low. But you're going to find out different here. People over 60, there's no association between LDL cholesterol and heart disease. And those with higher LDL, the exact opposite of what you've been told, actually live longer. Many, many studies, all published in medical journals. There's no consistent correlation between lowering LDL cholesterol and the reduction of heart attacks. Now, I'm getting all of this, everything that I'm showing you right now, from medical journals and also books that have been written by cardiologists who've done over 33 randomly controlled studies. So it's out there. This is from 1994, by the way. Journal of the American Medical Association published this. They said people with low total cholesterol have just as many heart attacks as those with high total cholesterol. So, why am I going over this now? Probably the majority of you have already been to a workshop where we covered this. But it never ceases to amaze me that we still have the conversation where you come back from the doctor with your labs and you're anxious because of what they said. Doesn't matter what I say. Doesn't matter how much research we go over. If the words come out of the mouth of a person with a white coat in the labs, you're quaking in your boots. And my wish and my prayer is that you would stop that and that you would just understand and own the fact that your body's smart, it's not stupid, and if you are practicing proper lifestyle, all these things are going to fall in place. And if you watch the Heart Smart Nutrition Workshop, you'll find that the thing you need to be concerned about is not how high your LDL is, it's how low your HDL is, and your overall total cholesterol divided by your HDL. That's the thing that you have to be concerned about. Now I go over all this with you guys, but the most important thing I want you to understand is this. If you're a patient of mine and you're still taking cholesterol medications, I love you just the same. But I wish you would consider otherwise, because you're all here because you want to prevent problems. And so if there are unanswered questions, please see me so I can help you along. All right, many patients who stop taking their statin drugs report improvement in cognitive problems in a matter of weeks. Here's something that was new, published in the National Library of Medicine. I found this. higher total cholesterol concentration may be associated with better cognitive performance in elderly females. It doesn't say lower total concentration, it says what? Higher, yes. The background of the study points to the fact that the brain contains the highest level of cholesterol in the body. The most concentration of cholesterol in your body is not in your blood from the food that you eat. It's in your brain. That should tell you something, that God doesn't make junk. And the amount of serum cholesterol in your blood has a huge impact on brain aging and cognitive performance. So the conclusion of the study found that a higher concentration of total cholesterol measured in late life may be a what? Protective factor for cognitive performance among females over 60, especially. So once again, what's the point? If you're trying to reduce your cholesterol, you're throwing the baby out with the bathwater. You're missing the whole point. Not only are you not getting the peace of mind thinking that you're going to prevent a heart attack or reduce your risk of that, which we learned is not true, you're also increasing your risk of cognitive decline, dementia, Alzheimer's disease. To me, that's not a good deal. Wouldn't you agree? So once Alzheimer's or neurodegenerative diseases like Parkinson's are diagnosed, you have very few choices. Yes, you can implement lifestyle changes. However, once you're on the decline, it's very, very difficult to stop it. Traditional treatments that they use, L-DOPA treatments, cardidopa, enzyme inhibitors, dopamine. Some of you may have heard of these drugs and different procedures, glutamate receptors. I'm not going to go through each one of these, but these are the typical approaches that neurologists will pursue in extreme cases of dementia and Alzheimer's disease especially. So these treatments are marginally effective, but the problem is they come with devastating side effects. And 70% of the patients statistically suffer from other side effects, such as sleep disturbances, uncontrolled writhing, constant moving, nausea, vomiting, blood pressure, and hallucinations. So what you're actually getting is very low return on the investment in these procedures. So the drug treatments slow down the progression of disease very, very little. And ultimately, it's like you're heading for the falls, your motor's broken, you don't have any oars, and what do you have? You have what? Somewhere between 4 and 8 years. So by the time Alzheimer's is diagnosed, it's already been there developing for about a good decade. So let me ask you this. If you knew that you're going to be diagnosed with Alzheimer's 10 years from now, you were sitting in front of a doctor and they said, this is what the tests show, you have Alzheimer's. And you could rewind that and go back 10 years, what would you start doing immediately? Everything you could do to prevent it, right? So when's the best time to start working on this? Right now, yeah. And that's why I wanted to show you this picture. It's too late. Once you hear the roar of the falls, it's too late. There's really not much you can do. The time to start is now. Yeah. So here's what we can do. And these are facts. And it's amazing how simple they are, but how powerful and profound it is. Typically, the part of the brain which is for learning and memory is called the hippocampus. Everybody say hippocampus. Hippopotamus. It's not a hippopotamus, it's a hippocampus. I don't know why they call it that, but that's what it's called. So that's the part that you need for our memory, and typically we lose about 1 to 2% of the neurons every single year that we get older. However, studies are showing now that people who exercise actually have enlargement of those areas. There's a 1-year study actually showed the increase in the size of the hippocampus in elderly individuals engaging in moderate intensity aerobic exercise for 20 minutes, 3 times a week. These participants also experienced an increase in memory function as well as increased serum levels of BDNF. What is BDNF? Brain-derived neurotrophic factor. And this is like plant grow for your brain. This is the fertilizer for your brain that allows you to grow new brain cells in the hippocampus particularly. And so they found that exercise stimulated that. Exercise fertilized your brain. So that's just 3 times a week. Imagine if you did it more. Non-exercising control group who just did stretching and toning and things like yoga, which is not bad for you. But what did the study show? They did not experience the increased size in the hippocampus. They actually experienced what? A decrease. So not all exercise or recreation in that form or fashion is created equal. So what do we need to do? We need exercise. We need exercise. Now, brisk walking is good, but the more research that I do, and the more of these workshops you're going to come to, the more studies you're going to learn showing the biggest bang for the buck that you could get for the time that you exercise is resistance training. And so I like to mix up both. I'll go for a brisk walk a couple days a week, but I'll lift weights closer to 3 or 4 days a week. And so I would strongly recommend that you consider that because it works different parts of your brain and you get different benefits, not to mention helping to build your body bone density, which is one of those risks that you are concerned about as you get older anyway. So highly encourage you to consider the resistance training. As far as aging gracefully, there's nothing more powerful than that. Or you can be like Bob Barker there on the dance floor, cutting the rug. It's good to get different movements in, whether it's mountain biking or dancing. It uses different parts of the brain as far as coordination. And you want to find new exercises for the brain, not just physically, but mentally also. Learn something new, like a new language or a musical instrument. This is part of the CANI, constant, never-ending improvement. Learning new things keeps your brain flexible like a muscle. You need to exercise it. And board games like Scrabble, getting together with people and doing these things, playing Scrabble or jigsaw puzzles, fellowshipping with friends. You need to practice these social connections and these mental connections and signing up for local education classes, like what you're doing tonight, right? Why do we have the monthly workshops? Why do we do this every month? Why have we been doing this for the last 25 years? Because, like I said, when you stop learning, you stop growing, and when you stop growing, you start dying. And so, next month we have building a titanium immune system. The month after that we have heart smart nutrition. The month after that we have cancer prevention. There's always something you're going to continue to learn and grow and improve with when you show up here. You're always that much better for it. Right, Hyacinth? Yes. Yes. So, constant never-ending improvement in the Elevation Health Essentials. How many of you opened the weekly emails that I send out? And good. And then we do the postal newsletters. We usually do those every other month. Right now, you getting those in the mail? Yeah. All right. If you're not, you have to see them up front. We're going to get you on our list, and then I'll post things on Facebook also. So if you're not connected to these avenues, make sure that we help you with that, because we certainly want to. Here's a little tidbit. They found that people with a bachelor's degree or higher live about 9 years longer than people who don't graduate high school. I know that's generally speaking, but that was a study that was reported in 2012 from the CDC. So there is a connection between learning and living longer. So put that in your pipe and smoke it. All right, so what else causes brain damage? Stress. Raise your hand if you don't have any stress. Raise your hand if you give stress. I know there's a few in you here. We always have a good time with that. But what does stress do? Chronically high stress levels. People who can't control the stress in their life, they're always exposed to stress. Your body has to try to adapt to that. And you churn through minerals, you churn through vitamins, it burns out your adrenal glands, it burns out your nervous system, it burns out your immune system, and it destroys your hippocampus. And it also reduces that BDNF, the brain-derived neurotrophic factor. So instead of your brain growing, it what? Shrinks because of stress. So when you're under constant stress like that, it's been said that you double your risk of Alzheimer's disease. So being that we're all under some level of stress, the question is, what's your plan? Well, easy enough when you do sleep, if you sleep consistently, if you have a good sleep schedule, we call that good sleep hygiene. When it's a priority in your life, you actually get multiple benefits. But it has to be a priority, and you have to set this up on a rhythm so that you do get the benefits of it. I think a lot of people overlook the fact that your brain actually detoxifies while you sleep. And it pulls these toxic proteins which would otherwise cause that beta amyloid and those neurofibril entanglements which lead to Alzheimer's disease. When you sleep, your brain has an opportunity to start purging that and cycling that out, like putting it through a washing machine. Did you know that? So it's not just a matter of getting on your back and resting. No, your brain needs to sleep. You have to sleep. You need to sleep. And when you treat your body and your brain with respect and you give it what it needs, you get the highest health benefits and outcomes that you're looking for clinically. So what should we do? Most studies and most research shows that most people need somewhere between 7 and 8 hours a night. And I know some people say, well, I go 5, 6, but I'm just saying in general, we look for 7 to 8 hours. It's got to be cold. It should be closer to 72 degrees. And if you think that's too cold, then you need to throw another blanket on top of you. But you have to keep your room dark and cold if you want optimal conditions for you to achieve the proper depths of sleep. There's REM sleep, there's deep sleep, there are all these sleep cycles that your brain and your body goes in and out of. And in order to do that, you have to set the environment properly. You shouldn't have light beaming in. Your room should be cave-like dark. You should have a consistent schedule. What does that mean? It means going to sleep and waking up at the same time, more or less, every day. Within a 15 to 30 minute window. So if you go to sleep 10 o'clock every night, then you should be getting up what? Around 6 o'clock every night. If you go to sleep if you need to get up at 5, then you should be getting in bed closer to 9. Even if you don't fall asleep until 9:30, you're still in bed winding down, right? But you're still creating that cycle, and your body will get used to that. The earlier you have to get up, the earlier you need to get in bed. And the earlier you get up, the earlier you will want to get in bed because your body's going to start winding down earlier because you've been up more hours during the day. Makes sense, doesn't it? Now, what will happen, though, is if we get off schedule, if you're used to getting up at 5 o'clock every day and you go to sleep at 9 or 10 o'clock every night, well, come Friday night, if you want to stay up late, watch a movie, or hang out, and you're going to come home at midnight, 1 o'clock, and you're thinking to yourself, well, I'll just sleep an extra 3 hours the next day. What happens? And your body wakes up at what? Regular time. So that you don't want to make that mistake. We all regret it when it does because you walk around like a zombie the next day. So stay on a sleep cycle, keep it regular, keep it consistent. What happens is we all have a melatonin window, which means as the evening draws nearer to a close, to your bedtime, your melatonin levels start to rise. And that's what causes you to get drowsy and get ready for bed. Now, guess what shuts that window down? Just what causes that melatonin to shut down? LED, blue light, from TV, looking at your phone, your computer. So what do you need to do? Either stop it or wear those blue light glasses to protect yourself and make sure that your melatonin window doesn't get affected, because you might fall asleep, but you're not going to get into that REM sleep that you need, or you may be compromising your deep sleep. And your sleep will not be healthy, it will not be good, and it's going to deprive your brain of what it needs to do. Same can be said of caffeine. If you're having coffee, late in the day, 4 or 5 o'clock, coffee has a half-life of at least 6 hours, or longer, 7 hours, some people 8 hours. It just depends on how it affects you. So I would not drink coffee if it was me, because I know my body. I will not drink coffee past 1:30 in the afternoon because I know I'd regret it later. So you try not to eat right before you go to sleep. When your body's sleeping, it needs to heal. It doesn't need to be digesting. It can't be doing both at the same time. So you need to give your body a chance, an opportunity to digest that food before you go to sleep. And exercise also helps you sleep. On those days that you exercise, you will notice that you do sleep better. And if any of you use a sauna, you will also know on the days that you use your sauna, you will sleep better on those days also. Because the sauna actually mimics exercise in some way, shape, or form, as it causes an increase in your heart rate. So, one of the most important things as far as sleep and also detoxification, the things that you can do is sauna. And then Neuromag, which is a supplement, which is magnesium threonate. Everybody say threonate. Threonate. Okay, that's different from magnesium citrate and malate. Magnesium threonate is the only form of magnesium which can cross the blood-brain barrier. And so people get this confused, and then they don't get the clinical result. A lot of people like to take magnesium for their blood pressure. However, this one particular resource is good if you ever find yourself having trouble sleeping. I mean, there's more reasons to use it than not, but I have a personal testimony about this. Sunday night, I don't know why, but I got a headache. Started coming on when I came home from church, and then by the time 6, 7 o'clock rolled around, my head was pounding. And it's very rare. I don't usually get headaches like that. And I went to sleep. It was 8 o'clock. I woke up at 1 o'clock, and my head was still pounding. And I couldn't fall back to sleep. So I got out of bed, went and got some water. I figured maybe I'm dehydrated. I was working outside. I was sweating all day, and drank some water. Went back to bed. I couldn't fall asleep. My head was still pounding. So an hour later, I get up. I'm trying to read. I'm trying to do all these, tricks to fall asleep. I can't fall asleep. So I go back in the kitchen, and I get the Neuromag. Put a scoop of that in water, stirred it up, went back to bed, and within about 5 or 10 minutes, all of a sudden I noticed I didn't have the pressure in my head anymore. And then next thing I know, my alarm's going off. It's 5 in the morning. Put me right to sleep. So as soon as that happened, I was like, whoa, all right. There's no way I'm not going to be sharing this tonight at the workshop, because that worked like magic for me. So if anybody has any issues with winding down, falling asleep, staying asleep, highly recommend this. A lot of my patients take it. They love it. Stress management, let's talk about one more strategy. And this, again, I can talk to you, realistically, this is coming from my heart, because this is who I am, this is what I do. And I've talked to you about this probably many more workshops if you haven't heard this yet, but I will never start my day without praying and reading the Bible and then exercising. And I call this the spiritual triathlon because who can anchor to an unanchored mind? Do you want to be a tumbleweed, or do you want to have a strong, solid rock foundation? And, we walk in this world, but we're not of this world. We're spiritual beings having a physical existence. And we have problems and we have stress, but you have to know who you are. And you have to know what your purpose is in life. And every day I wake up and I reaffirm that. And I pray. I pray whether I got problems or I don't. But the Bible says we enter his gates in thanksgiving. So one of the best ways to start your day, to make sure that you're not thinking about problems, because I guarantee you, when you look in the mirror and you stick that toothbrush in your mouth, you're thinking the same old stinking thoughts that I am. What's bad? What bad happened yesterday? What's bad going to happen today? That's your default, right? But as soon as you enter his gates in thanksgiving, as soon as you start thanking the Lord, thank you for this day. Thank you for our home. Thank you for our family. Thank you for your word. Thank you for your son, Jesus Christ, who died on the cross for me to save me from my sins. Thank you for grace and salvation. Thank you for the gifts and the talents you've given me to serve you today by serving other people. You walk in gratitude. How could you start your day in stress? Right? And you know what? We all have what's available to us if we only make that choice, that decision. And not everybody understands that. Everybody thinks, well, we're all children of God. And that's not true. We're not all children of God. The Bible says we're children of wrath. You're a child of God if you know the living God. And that's when you give your life to Jesus Christ as your Lord and Savior. And only then do you have assurance. And can you walk in that peace? And can you talk to your Heavenly Father like He's your earthly Father? Why would you not want to do that The Bible says, cast your cares on him because he cares for you. Why would you not take your problems to the Lord? Why would you not take your problems to the Lord? When we were on our road trip a couple of weeks ago, I had a double blowout on my trailer. I was in Jacksonville, right outside of Jacksonville, Florida. I had my car, my family. We had 2 blowouts right on the side of the road. And so, I was thankful. I inflated my 2 spares. I always carry 2 spares. So I inflated those before we got on the road. So I'm standing on the side of the road. We got me and my boys. We put our tires on. We were back on the road in 40 minutes. It wasn't really a big deal, but we blew out the spares too. So actually 1 spare blew. So when we got into Charleston, it was nighttime, and we got out, and Gavin said, "Oh, Dad, look, you got another flat." So that's it. I'm out of spares. I'm on old tires. And there's no way that we're driving from Charleston up to Alton, Virginia, another 7-8 hours the next day. And we stopped in Charleston just to, just sightsee. And now I'm just hoping that I can find a place to get tires for my trailer. So what did I do? All I could do was just pray. I thought to myself, you know what? If we have to spend the next couple of days or whatever, we'll do what we can do. But I prayed. I took it to the Lord. And you know what? As soon as I did that, you know what I had? I didn't have a guarantee. But you know what I had? I had peace. I had peace. Peace that surpasses all understanding. And so when I'm talking about this, guys, understand that, I may be a doctor of the body or the nervous system and, that physical part of it. But if you don't have peace, that affects the physical part of that. So I'd be robbing you of the truth if I didn't give you the whole truth. And this is it. You need to find your peace. First, you have to have peace with God before you have the peace of God. Yeah. And so that's a decision that you have to make if you haven't made it already. Unplug, take a walk, take a power nap, go outside, spend time with family and friends, fellowship. And this cannot be overlooked. Okay. So that's our stress management. Now I want to share this part with you, which is addressing the nervous system. This was your first slide. We talked about addressing the nervous system. And this is a pro football player that ESPN did a special with. Used to be a quarterback, Jim McMahon.
See, that one don't go there. There we go. This is what I do to try to keep my brain sharp during the day. I've got these puzzles, and it helps me to just try to remember things, colors and where things go. Well, I knew I was missing a couple pieces. The doctor actually told me that this would actually be good for me to help keep my brain sharp and functioning, because at times it tends to wander.
Jim McMahon is 56 years old. He now spends most of his time in his Scottsdale, Arizona home, where the dry desert air best suits his long list of post-football aches and pains.
This is my daily routine. What am I doing? What am I looking for?
But what the climate can't combat are the symptoms associated with brain trauma McMahon suffered as a player.
Bad headaches, pressure on my skull. I couldn't see very well. I couldn't talk very well. All I wanted to do was lay down, because my head was just constantly pounding. The pain had gotten so bad where if I had a gun, I would have been here. And these 2 doctors from New York called me and said, "Hey, we think we can help you. We think we know what's going on." I said, "Let's do it."
Jim was diagnosed with early onset dementia. He had been complaining about a brain fog, as he described it, as well as he described it, a headache where he felt like I was picking on both sides of his brain.
While most concussion studies are focused on the brain, McMahon's team traces the effects of CTE directly to the upper spine, having found that neck misalignment can block the flow of spinal fluid and pool toxic proteins directly onto the brain.
Spinal fluid is white, and that's the spinal cord. This is the spinal column. What you're seeing is a narrowing of the opening where the spinal fluid is supposed to come through.
Most times when you're having head problems, that's all they look at is the head. These guys were smart enough to at least look below the head at the neck and see if there was a problem somewhere, and they found my problem. They're not going to be able to reverse the damage. Like I said, that stuff was sitting in there for 20 years. So how much it ate away at my brain, I don't know.
Using detailed images captured by the MRI scans, McMahon regularly receives targeted adjustments, clearing the blockage and restoring the flow of spinal fluid.
This instrument is going to generate a gentle mechanical tapping that is just lightly going to put those bones right back into normal condition. Okay. Going to sit back up.
First time they did this procedure, within 2 minutes, it was like the toilet flush. I could feel this stuff actually leaving my brain. My eyes cleared up, my speech cleared up.
The left is before, the right is after. So you see how much there is there? See how there's less in here? Instead of all this white stuff being there, you see more brain tissue than fluid. So it's already started to bleed. Over the next several days, it will improve for it.
What damage it's done, it's done. I can't reverse that. But what these guys do for me, they keep me from having these bad pains, having these suicidal thoughts.
So what you actually saw was the vertebrae that were out of alignment, which was interfering with the cerebrospinal fluid. It was building up, causing pressure in his head. Some of you guys have felt that. But there's actually another component there that they talked about, which was pulling the toxic proteins into his brain, which was causing the Alzheimer's disease. All because of what? The misalignment of the vertebrae in his neck. Now this was years after he retired. Can you imagine if he was getting adjusted as those impacts were occurring that caused that? Probably could have prevented it, right? So when it comes to preventing dementia and preventing Alzheimer's, this is the #1 factor, because you can eat good and you can exercise and you can take supplements and you can do all these things. But if your brain is not able to intelligently coordinate and harmonize all the function and healing aspects that your body needs, then it's all for naught. Like you see this chart over here on the left side. It says the nervous system controls and coordinates all organs and structures of the body. That comes from Gray's Anatomy, 29th edition. Misaligned spinal vertebrae and discs can cause irritation to the nervous system, which can affect structures, organs, and functions listed under areas and possible symptoms that are associated with. So if you have a vertebrae that's out of alignment in the upper part of the neck, and that's the area that controls the blood supply to the head, your immune system, your balance, your vision, your coordination, what kind of problems are you going to have? Headaches, nervousness, trouble sleeping, high blood pressure. Now lots of people have misalignments up there, but they don't have those symptoms. And to me, based on my experience doing this for 31 years, the only difference there is time. You leave it there long enough, and then it'll develop. So when's the best time to have that corrected? Before it ever rears its ugly head, right? If in that area at the base of the neck, that's your thyroid. In the middle part of your back, you have your liver, your stomach, digestive issues, your blood sugar, your pancreas, your colon. I mean, think about this. These are all areas that have to do with your hormones, that have to do with detoxification. If those organs are not functioning properly, how does that affect your risk of dementia or Alzheimer's disease? Because you're not getting proper nerve supply. So that's a whole different story. So think about the fact that your body knows how to heal a cut. Your body knows how to mend a broken bone. Your body knows how to heal cancer. It knows how to grow new blood vessels. It knew how to take you from 2 cells, right, when you were first conceived, to the walking human flesh, the miracle that you are right now. Think about how intelligently designed your body is. And then I want you to think about what system is being utilized for that intelligence to communicate and coordinate all functions in your body. What system is it? Nervous. It's your what? It's your nervous system. So, do you understand why you have vertebrae now up and down your spinal cord? To what? To protect the most important system. Is there anything that can interfere with the expression of that inborn intelligence? Yeah. Well, if the vertebrae are meant to be in alignment to protect it, if they go out of alignment and they're not protecting it anymore, what are they doing to the nervous system? Interfering with it. And what does that do to the expression and communication of innate intelligence trying to get through, allowing your body to adapt and heal? It affects it. It lowers your potential to heal and function at your God-given ability. You see, there's anybody watching the Olympics? Which one of the Olympic athletes is getting adjusted? Some of them or all of them? All of them. Is it because they have dementia or back pain or neck pain? No. Why are they getting adjusted? Not a trick question. To optimize their what? Performance. Yeah, so they could win a gold medal. Aren't you entitled to be a gold medalist in everyday life? Yeah. So, like I said, you can eat good and exercise and do all these things, but if you've got subluxation, the number one factor that's interfering with proper neurological communication, you're shutting down your power panel. And you don't have to have symptoms to have that going on. Some people do, some people don't. But you want to find it and catch it before it does. That's the most valuable part. Do people come in here when their neck and their back hurts? Sure, all the time. But the people who do it preventatively, proactively, have to do the least, and they get the best results, and they have the highest possible outcome if you get started with it before anything happens. How do we screen out whether you have nerve interference or subluxation? You do it with thermography, that's one way, and also x-rays. And we look and we compare those two together. You see on the left side there, down there where all those colors are, skin temperature is affected by nerve interference. So when we run a thermal scan, we could see an abnormal pattern. It says, okay, well, this is abnormal, here's what we're suspecting here, here, here. And then when we take an x-ray, we see it. And that confirms or rules out what we suspect. And that eliminates the guesswork. Now, if somebody has a problem, those tests will show us where the cause, source, and the root of that's coming from. If somebody presents asymptomatic or they don't have a problem, and we find something like that on the left, which is all messy and ugly, what do we say? Goody! Thank goodness! We've caught it before it put somebody on medication or in a hospital or wound up surgery. What is that worth? Yeah. What is it worth to prevent disease than to wind up treating it and only being able to slow it down, right? Or having to be on a medication for the rest of your life. So, who should be having their spine checked on a regular basis? Everyone. If you want a healthy nervous system, which is at the core of everything else good that you do for yourself. So this is something that we do for our regular patients, at least once a year. But if you're a guest here, we're going to give you an opportunity to have that done. You can make an appointment. Normally, it's over $500 to have all that done: the consultation, the exam, the X-rays, the scans, the report of findings. But before you leave, if you ask for one of these, it's a friends and family coupon. You can have that done for only $97. So that's an amazing gift that you can give yourself on behalf of the loving individual who invited you here. And you can take advantage of that to allow us to screen you and see if you need attention in any of those areas. Fair enough? Yeah. All right. So the mind can only absorb what the seat can endure. So I'm going to have everybody stand up right now and turn and face the person on your right. Put your hands on their shoulders. And we're going to do a quick massage. Good. Squeeze. Good. Squeeze. Get that stress out. All right, karate chop. Karate chop. Be gentle. Love your neighbor, don't hurt your neighbor. All right, turn around, love your other neighbor. Get that stress out. Good job, good job. All right, karate chop. Nice work, nice work. All right, give yourself a round of applause. Deborah, tomorrow, can I have you real quick? I just want to recognize, well, we still got a little bit more to go. Don't leave yet. I want to recognize two people for perfect adjustment attendance. And one of them actually left?
That was childcare.
Oh, okay. Well, we can give him his tomorrow morning. Okay. And then for perfect adjustment attendance, our first award goes to Sandra Allen. You're in the back there. Everybody give her a big round of applause. And then we have our highly coveted Core 4 University graduate degree. And this is for Reggie and Vivette Blackwood for being at 6 or more workshops. Everybody give them a big round of applause. Yes. Thank you, guys. Wonderful, wonderful. Okay, that didn't take too long. All right, so we're going to just finish up, put our finishing touches on this. Understanding that low HDL and high glucose starts to precipitate the development of dementia and Alzheimer's disease in midlife from age 35. This was from the Framingham Heart Study, one of the largest heart trial studies that they've done. And the author of the study said the higher glucose levels in the blood are linked to the more severe plaques. And they said when this goes on long enough, something called neuroinflammation becomes present. What is neuroinflammation? Inflammation of what? The nervous tissues. Could be the nerves in your body, but mostly the brain for purposes of our discussion. So how many of you know what your A1C is? Good. Because if it's over 5.7, you are on your way to Alzheimer's disease. And don't shoot the messenger, but this comes from Journal of Neurology. Showed brain shrinkage with high A1C. So memory function is directly affected by blood sugar. We know that now. It's a fact. High blood glucose and insulin shrinks your hippocampus. There's a direct correlation between your A1C and the brain shrinking. The higher your A1C, the smaller your brain. New England Journal of Medicine, 11 years ago, published a study. They showed even mild elevation of blood sugar. 105 to 110 is associated with elevated risk for dementia. Becoming a diabetic, what? Doubles your probability of Alzheimer's disease. So I wouldn't be so concerned about your blood sugar from a diabetic standpoint as I would from a brain standpoint. Obviously, it's more of a reason why to get it under control. We know diabetes has devastating consequences on so many different fronts. So what do we need to do? Kill the sugars before they kill you. Elevated insulin destroys brain function. It causes inflammation of the brain, neuroinflammation. So that's why neurologists now are calling this type 3 diabetes. We know what type 1 and type 2 diabetes are. Have you ever heard of type 3 diabetes? That's early onset dementia, cognitive decline from elevated insulin levels. And this is what the research has been pointing to for years now. It drives inflammation, and what else does sugar do? It destroys your gut bacteria, which is your microbiome, which is your second brain on many different levels. Brain inflammation equals brain degeneration. So there are bad fats, there's artificial sweeteners, toxins, metals, all these toxins we have to look out for because they drive inflammation. Trans fats, are you reading the labels? You know, cookies, boxed cereals, even the breads that you would get from your grocery store, freshly baked breads, if it has a label on it, you would be shocked to see that there are hydrogenated fats or partially hydrogenated vegetable oils. Look at the label, look for trans fats or hydrogenated oils because it drives inflammation. And it causes not just brain disease, but disease on a lot of different levels. It destroys your metabolism. It's hiding in our favorite home recipes. Peanut butter, popcorn, the Smart Balance, the so-called healthy butter, you know, the donuts, the cookies. Even if you go to your favorite fresh Tex-Mex restaurant, what do you think they're grilling your meats on? Or your veggies? Vegetable oil, which is going to cause inflammation. So we need to, again, start putting this on our radar, reading the labels, because you become what you eat. You become what you eat, and it's not just what you eat; it's what you eat ate. Because what are we eating now? It's everything that was fed to the farm animals and the crops. So we need to make the shift from all that, the refined carbohydrates, the pasta, the breads, right? Or even the whole healthy grains. They're not really so healthy anymore. They may have been healthy, centuries ago, but now they're all processed. They're refined. Not to mention, sprayed with the latest from Monsanto. So we need to make the transition there. What do you see on this right side here? What do you not see that you see in the picture on the left? You don't see those carbohydrates. Now you do see other carbohydrates in the form of fruits and vegetables, but I would say if you have any form of dementia, diabetes, high blood pressure, cholesterol issues, heart issues, that this would be the way to go. And once you get those levels under control and you get things under control and you want to add some basmati or jasmine rice, it will not have the same glycemic effect to provoke that insulin response like pasta or bread or potatoes and things like that. So that paleo diet right there is an easy on ramp for most of us in the room. What's it called? Paleo diet. Yeah, it's an easy transition for most of us. So another thing that you should be looking for is to get more good fats. Your daily diet, your intake, should be the majority of food that you eat should be greens and good fats, not carbohydrates. And those good fats can come in the form of many different sources, like nuts, pecans, macadamia nuts, walnuts, almonds, right? Avocados, extra virgin olive oil. You have your grass-fed butter. You have your grass-fed ghee, which is clarified butter. You have your coconut oil. What else? The Ultraplex EPA. What is your brain made out of? What did we say before? Cholesterol, which is what? Fat. So the EPA, these essential fats, are crucial for proper brain function and highly preventative for Alzheimer's disease. A study of 485 people ages 55 and over showed those who took the DHA supplements for 6 months demonstrated significant improvements in memory and learning. The study also showed that higher DHA intake is inversely correlated with the relative risk of Alzheimer's. So the more of those fish oils that you consume, the less likely you get Alzheimer's disease. So the omega oils protect the brain and help counteract the inflammation. That's why we're always recommending that to you. Some of you guys take one a day. That may or may not be enough. The only way to know is to get tested. How do you know if you're getting enough? Well, we have a test that we do. And this is why we do this for all of our patients that are on maintenance care. At least once a year, we're going to look in there. Because just like vitamin D, how many of you found you were taking vitamin D once a day and you were still deficient? Same thing that we found with the EPA. Now, every red blood cell in your body should have somewhere between 8 and 12% if you want good brain health, eye health, heart health. If you're deficient, if you're in the 4 or less range, that's the recipe for brain shrinkage and sudden cardiac death. That's why this is so important. Now, if you go to a contemporary medical doctor, cardiologist, neurologist, this is not going to be on their blood panel. That's why we found our own kit where we can actually take a finger prick blood test, and we do it right here in the office. And we've done it for many of you. And what did many of you find? If you were deficient, what did you have to do? You had to double your what? Your fish oil capsules. At least that. If not, add some more oil sources from your diet. So that's the desirable range. That's where you want to go. And in our office, we don't guess. We test. And that's how we know. And this is how we make a fail-safe plan to implement all the aspects to prevent brain degeneration. Curcumin, another one besides the EPA, which actually helps your body produce BDNF. It helps your body make this stuff. So, and it's a powerful anti-inflammatory. It attacks the amyloid plaques. Also destroys cancer cells, which is important. How about coffee? Raise your hand if you like coffee. So, also for our brain workshop, you get to enjoy a cup of coffee. It improves cognition, and what else does it raise? BDNF, yeah. It contains a polyphenol called chlorogenic acid, which reduces chronic inflammation, in particular in the brain cells, high fat cells. Also found that coffee drinkers of midlife had lower risk for dementia and Alzheimer's disease later in life compared to those drinking little or no coffee. The lowest risk, the people at a 65% less risk, had 3 to 5 cups per day. Now, I don't think that would work for me, but that's just reporting the study. I'll usually have 2 cups at the most, but that's it. So, the gut-brain connection is what we're talking about to make sure that that second brain is healthy. So 80% of your immune system is in the what? Yep. 80% of major brain neurotransmitters are made where? In the gut. Toxins, pathogens, and viruses, we now know, can also cross through the blood-brain barrier and aid in the creation of that beta amyloid plaque. So this is something it's part of the causative factors. And scientists now think the way that the protein in the Lewy bodies, the Lewy body dementia is what, what's his name, Robin Williams. That's what he had. You remember Robin Williams, the comedian, right? So it's a much rarer form of dementia. It actually incorporates some of the symptoms of Parkinson's too. But they're thinking now that it starts in the gut and it travels to the brain, perhaps by way of the vagus nerve. And the vagus nerve is affected by the top bone of the neck and the atlas. So leaky gut starts with understanding how important it is that you take care of your gut with probiotics, fermented foods, pickles, sauerkraut, all the fermented foods that you can have help to repopulate the normal flora and help to either prevent that or treat what we've already done to it through a bad diet, stress, toxins, alcohol, infections. Because what happens is all that stuff causes inflammation and it separates the tight junctions there and allows those toxins and pathogens to get through and breach the blood-brain barrier. And this is what they're linking to forms of dementia. So that's why your gut is so important. Is this making sense to everybody? You have to have your gut given proper nutritional support. So reducing sugar is part of that. But the other part of that is making sure that you get a good spectrum of probiotics. Like I said, there are probiotics in kefir and different forms of food that you can take. But one of the safest ways to hedge your bet around that is to take a probiotic. How many of you guys take a probiotic? At least one a day. I will always consistently do that as long as I want a consistent bowel movement. And if you don't have that, then this is an easy fix for that. But this is very, very important because it helps your body absorb the proper nutrients, heal and support the gut, and that in turn heals and supports the brain, and supports proper brain function and prevents dementia and Alzheimer's, and not to mention neurotransmitter support. A lot of studies with depression and things like that go hand in hand with this. And we talked about toxins breaching the blood-brain barrier, and I don't want to finish the workshop without you understanding this, that the three amigos, the top three, that you need to make sure that you've addressed, because this is one of the most powerful precipitators of Alzheimer's disease and dementia, these three right here, lead, mercury, and pesticides. Lead, if you didn't know this, gets passed down from generation to generation. If you were not hatched from an egg, if you were born by way of a placenta, then you did get some level of mercury passed to you from your mother. And they've done this, they've looked at all the placentas, they've done the studies, and it just does. And we all have some levels of this from that and then the environment. And what happens is it gets stored in your bones. And anytime you go through hormonal changes in life, like puberty, pregnancy, as you get older, anytime you go through hormonal menopause, your body will release that stored lead. And then it gets into your bloodstream, and then it gets into your brain. And it blocks the synapses, and it causes... We know there's high blood pressure cases due to this. There's heart disease, there's Alzheimer's, also weight gain. So this is a very real factor when it comes to this. So your mercury exposure can come in different forms. Everybody's different. Everybody has different tolerances for it. But the question is not, are you toxic? The question is, how toxic are you? We all have toxins in our body, but our bodies can present with different levels of the ability to deal with it. It comes in the form of air, water, fish, swordfish, tuna, Amalgam fillings, they're 50% metallic mercury, if you didn't know that. So some of us, nowadays most dentists don't use that. They have composite fillings, but the amalgam fillings, if you have those, there is research to show that the vapors that come off of that during cleanings, hot liquids, can actually allow vapor mercury to go into your brain. And anytime you introduce mercury to live nerve tissue, you will see it atrophy. This is a study, I'm going to show you a video right now from the University of Calgary, which showed how a minute amount of mercury affects the nerve tissue. I want you to watch this here.
Shown here is the neurite of a live neuron isolated from snail brain tissue, displaying linear growth due to growth cone activity. It is important to note that growth cones in all animal species, ranging from snails to humans, have identical structural and behavioral characteristics, and use proteins of virtually identical composition. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here. In contrast, other heavy metals added to.
So you saw what that did with the small amount of mercury, how it affected the nerve tissue. So that comes in the form of also vaccines, childhood vaccines, which have thimerosal in them as a preservative, flu shots. So these are the things that you have to watch out for, that you have to make informed decisions about. And if you have it in your system, then you have to ask yourself, how do I know if it's affecting me or not? And you can have symptoms, but the only way really to know is to get tested to look at your toxicity levels. Glyphosate is the third thing when we come to pesticides. Glyphosate is the active ingredient in Roundup. If you're not aware of this, new studies show that glyphosate actually opens the blood-brain barrier. And that's bad news, because not only will it allow that to get in, but synergistically it takes other toxins with it. This comes from the Journal of Inflammation. They show that the glyphosate successfully crosses the blood-brain barrier and infiltrates the brain. Once it's there, it enhances the critical levels of TNFA, which is tumor necrosis factor. So it turns the switch on for your body to build tumors, which is why when they've done laboratory studies with rats, they've shown tumors in their mammary glands and their necks so deforming them, within a matter of weeks, they were dead. So when they had the rats drinking out of the water with glyphosate in it. So again, with humans, obviously it takes a lot more over a lot longer period of time, but people are affected with this. As courts show, there are settlements that have been done with this. Study further demonstrates in cell culture studies that glyphosate exposure appears to increase the production of beta amyloid, which is what? The hallmark for Alzheimer's disease. So we got to get with this, guys. At all costs, you have to try to avoid this wherever it's in those sources. Where are the two things that they apply glyphosate? The majority, 70% of glyphosate applications to what? Corn and soy. And where does corn and soy get into? Everything. Yeah. What do they feed the cows, the chickens, the pigs, the fish? It's all corn. Soy, you'll find with tofu, you'll find in cereals, and then on some of the fruits. So it's ubiquitous. It's everywhere. That's why it's so important to buy organic and make sure you're reading those labels and try to steer clear of this stuff. Inherently, we're going to get some of it, whether we like it or not. That's why it's so important that you give your body what it needs to be able to support the detox process. So how does prolonged low-dose exposure to this affect your brain? And really more importantly, how does it interact and work with other chemicals? So think about our environment that we live in. According to the EPA, the indoor environment is 2 to 5 more toxic than your outdoor environment. The pillow you sleep on, your mattress, the formaldehyde in that, the toxins in your cosmetics, lead in the lipstick. There's toxins everywhere. It's in everything. So when you have more going in than your body can actually get out, you start to become symptomatic. You get fatigue, you get brain fog, you get headaches, and you just don't feel well regularly. And that's a good sign that you're toxic. You may or may not have that. whether you do or you don't have the symptoms of that, you should consider at some point doing some sort of cleanse in your body where you can actually pull all these toxins that have accumulated in your body out at a deeper level. Now, people always ask me, can I do like a cleanse? Can I do a juice cleanse? Can I do a fast, this and that? That doesn't get through the blood-brain barrier. That doesn't get it out of the brain. That's good for your gut, and that's pretty much it. And that's the extent of it. And then there are people who take like a one-a-day type of detox, and we used to do that. And what I learned was what somebody told me a long time ago, but I didn't listen because I wanted to make it convenient to people just to take a one-a-day, make it cheap and easy. But if you don't prepare the body to detox, you, number one, are not able to get to the deeper toxins, and number two, a lot of people have really bad reactions. Think about it. You go poking and prodding and wake the sleeping giant, and you start pulling those toxins out, your body recognizes it as foreign material. And what does it do? It sets off an inflammation response. And how do you feel? Woo-wee. Not good. So we don't do that anymore. We do it the right way. You have to go through a preparatory stage. You have to prepare your body to detox. You have to prepare the gut, the lymphatic system, the liver, your colon. All these things need to be prepared and heal all the cells so that they can function properly. And then after that, then you can detox the body, and then after that, you can detox the brain. So we have a very comprehensive, robust program that actually works, and we also have the objective evidence so that you could see that it's working. So those are the three phases that we take people through as far as a true cellular detox program goes. But the tests will show us when a person starts. You see this meta-oxy, that's an inflammation test. It's a urine test. And basically, it shows us systemic and cellular inflammation. The deeper the red, the more toxic the person is. And so when somebody starts and it looks like that, when they go through the program, after every month, after every phase, we retest, and you watch the color getting lighter and lighter as the inflammation subsides and the toxins leave the body. You know this. Some of you guys have done this, right? And then the other thing is toxins affect the optic nerve. So we have a visual contrast sensitivity test. It's not where you read the letters. It's lines. And if you're highly toxic, those lines you will not be able to discern. And there's a test that we take people through. And it's not just a test to see how toxic you are. It's a test also to objectively measure the improvement as you get well. In your handout, you had a questionnaire. That's the other thing that we use. Now, if this is something that you're interested and you'd like to make an appointment and have that testing done, to see how this is affecting you, if it is affecting you. Normally the tests are $300, but we'll do this as a special at the workshop for $97. For those of you who are patients and you've never had this done, if you want to do it, ask Deborah. She'll set it up for you. She'll go over it with you. If you're a candidate for the program, she'll go into answering all the questions. Now, here's the good news. For those of you who are guests and you're considering having your spine and your nerve system checked, I told you that since $97. We've decided to include this in that as well. So it's up to you to take advantage of this. The offer is only good for tonight. When I leave the building, the offer ends. So get it while it's hot. But they'll help you on the way out. So again, if you're having the consultation, the thermography, the exam, the x-rays, that'll be part of what we do, the whole kit and caboodle for you for $97, either way. And that's it. You guys got your handout for the supplement suites. You know what these supplements do. It's discounted tonight, the 15% off for the workshop, only for workshop attendees. This is the only time that we discount supplements while they're available. They're limited supplies. So please take advantage of that. So again, you can apply what you're learning tonight. And then, the thing is, why do we do this? Why do we do this? You're here for a reason. You're here because you want to make sure that you don't leave the same person that you walked in. It's one thing to get information, but what's more important than that? How do you apply it? How do you apply it? Are you going to apply it? And what's more important than the what is the why. What is your life going to look like 10 years from now? And it's not just you, it's the people who love you, the people who care about you, or the people who will be taking care of you. And that's a motivating enough thought for me. How about you? Yeah. The healthy person has 1,000 wishes, but a sick person only has one. So again, as I said, there's different people needing different things. For you guys who are guests here, the exam, X-rays, the detox testing. Make your appointment for that. Supplements if you need that, the omega-3 testing, and then the toxicity test. So we talked about all those things. Make application with the information. So thank you so much for being here tonight. I love and appreciate you. God bless.